When we talk about AI and healthcare, we need to understand it as a foundational change in the toolkit we have available. In the same way, and I mean this profoundly, that algebra changed our understanding of the world and of math.
In our field, the major changes are happening in the diagnosis testing. How we can now interpret them more effectively and without as much exercise needed. We are seeing the old patterns of the care change in new ways of doing care.
The topic of how AI is going to be so interesting because these new machines learning sophisticated models, they are not the end of the question. It's the beginning of the question.
AI is the future of healthcare. So we have been told, but what does it mean? Is it coming for your job? Is it saving your life? What risks does it pose? And how does it pose? And how does it have the potential to affect you?
Artificial intelligence has in some form been around for decades, but most people are just finding out about it because of things like ChatGPT, which have come into the mainstream. In healthcare, artificial intelligence has been around for years as well. It's helped doctors to transcribe their notes faster. It's helped patients experience with chatbots. But with generative AI, it's really supercharging what healthcare professionals and scientists are able to do by helping predict future health risks, make diagnosis faster and more accurately, and also helping with potential drug discovery for new novel treatments and therapeutics.
The AI boom really hit healthcare in the last 5 years. We have actually been able to transition into having the models or the tools we built to actually work, define new ways to treat diseases, new ways to diagnose diseases, and finally find individualized signature of how as a patient or somebody else as a patient would do if they got a certain treatment or therapy.
The Gen AI is assisting doctors in more advanced ways. But both clinicians and patients are questioning their risks these new technologies may bring with them.
I think a lot of people are wondering, what's the going to look like when I go to the hospital or when I go to the doctor? How is it going to be used to inform distance? What about the errors, false positives and false negatives? Who is going to be responsible? There's a lot of questions around this that really digs the expertise, the people in different areas.
So we have agencies like the US Food and Drug Administration that does oversee certain uses of AI in healthcare. There are also groups like the American Medical Association and the National Academy of Medicine that do put out guidelines and codes of conduct for responsible use of AI. So right now, there are experts and there are various groups that are trying to oversee this and make sure that it's used responsibly.
While facilities like the CARDS lab are developing these new AI tools at a rapid pace, there are still many steps needed before these technologies can be implemented to ensure the public well-being. Regulators may wish to impose oversight and guardrails before AI becomes the new standard practice of care.
In terms of a and misdiagnosis, experts say that the cases of an example of this are pretty limited at this point because even though an AI might make a mistake or might make a misdiagnosis, there is still a real doctor involved in the diagnosis or prescription of a medication.
Yeah, so we are really going to become healthier. I think it's now the just $1 million question. It's the million life question. There is benefit to technology, there is benefit to AI system, but it really requires that all of us, we need to be able to access and we need to be able to use this and we need to be willing to use it and we need to have that space or energy to do it.